Tánaiste, over the last number of months, we have regrettably borne witness to the scale of the crisis facing our health service on the watch of Minister Simon Harris. The debacle surrounding the cost of the National Children's Hospital rumbles on. Nurses and midwives have had to engage in industrial action. 1 in 7 consultant posts are vacant, and support staff have announced their intention to ballot for industrial action. All the while, hospital waiting lists continue to grow and hundreds of patients are left on hospital trolleys day in and day out. Last night, Tánaiste, in Cork University Hospital, there was a status black escalation declared, with patients attending the emergency department facing extreme delays of up to 12 hours and with services reaching breaking point. A status black escalation is declared, I understand, when the hospital is at maximum capacity and when it's deemed unsafe to admit further patients. So there is a capacity crisis in the health service, and this is very concerning, Tánaiste. There were 70 people on trolleys in Cork University Hospital this morning, with 570 people on trolleys across the state. Yesterday in Limerick, there were more people on trolleys than in Dublin's 9 hospitals combined, according to the INMO. I'm sure you'll agree that this is shocking. There are also reports, Tánaiste, that during the status black escalation, up to 8 ambulances were lined up outside the A&E at Cork University Hospital, waiting to hand over patients. I am told that one of those ambulances was forced to wait for more than 4 hours. Now, that's the sort of situation that puts patient and staff at serious risk, Tánaiste, and it's absolutely unacceptable. We have raised the capacity crisis over and over again with your government over the last number of years. Nurses were on the picket line raising this very issue just over a month ago. And all we see by way of response is inaction and indifference on the part of your minister. You are the ones, remember, who insisted that he remain in situ when we in Sinn Féin tabled our motion of no confidence in him. So what we need now is a robust response, Tánaiste. Last night in your own city, things got so bad that a black escalation was declared, the highest level of escalation possible. Staff tell us that it's the worst they have ever seen. So you must surely agree that this demands an adequate response. So can you tell me what is to happen at Cork University Hospital in the first instance, given this escalation over the last 24 hours? And then more generally, Tánaiste, what's the government's plan to respond to the capacity crisis in a manner that actually gets to the root cause of the problem and addresses the crisis sooner rather than later?
Tánaiste. Deputy, thank you for raising this issue. There were a lot of questions there, but let me deal with the ones in relation to Cork University Hospital, which is a hospital I know well. This morning, the number of patients waiting on trolleys in Cork University Hospital was 55. This morning, the HSE trolley system reported 431 patients waiting on trolleys nationally. This is an increase on the same day last year, when there were 296 patients awaiting trolleys. The number of patients waiting on trolleys in CUH this morning is exceptionally high. The HSE confirmed that the South-Southwest Hospital Group were on site and that community teams were actively seeking additional community beds to support discharges. In addition, the National Director of Acute Hospitals in the HSE will visit CUH today. The HSE identified specific issues and challenges on site. Firstly, significant capacity demand mismatch with high attendances, high admissions and low discharges. The hospital remains in full capacity protocol with the highest trolley count this year on site. Key actions are now underway in Cork University Hospital to improve the situation for patients. These actions include a full mobilisation of all resources, escalation meetings with the Group's CEO, and Group CCO arranged, meetings scheduled with consultants, review of diagnostics and cancellation of diagnostics tomorrow and Thursday, CHO representatives on site to review patients for transfer to step-down facilities, identification of patients to expedite transfers to local rehab, utilisation of private capacity. 5 beds, I understand, have been made available in the matter private, and use of private ambulances to transfer patients. So, Deputy, you're right. We have a serious challenge in CUH as of last night and again today. We are responding with the seriousness that's needed. We need and are putting the extra resources and the priority systems in place to respond to that in accordance with the needs of patients there.
So the status black escalation, Tánaiste, as you know, is a declaration essentially that a hospital is no longer safe. So in Cork University Hospital, the situation, as I said, was unsafe for patients in the first instance, but also for staff. And some of those staff who have worked within the system for decades, for 30 years, have told us directly that they have never seen the like of it. It was a dangerous situation. I've described for you the scenario. Ambulances lined up, and one that I know of waiting for more than 4 hours to hand over a patient. Now, this is a very, very serious accident waiting to happen, and it's playing out on your watch. What you have described, the actions that you have described there to me, the various meetings and so on, I'm advised are standard procedure in any event for hospitals on a full capacity protocol. So you're not describing for us any kind of emergency intervention commensurate with the crisis that has unfolded at this particular hospital.
Thank you, Deputy.
I've asked you, Tánaiste, and I'll ask you again. What is it that you are going to do additionally to intervene in the case of Cork University Hospital? And when will you accept that there is a capacity crisis within the system? And what are your plans, what are the plans of the Minister for Health and your government to address that?
Thank you, Deputy. Tánaiste.
Deputy, I know Cork University Hospital well, and I know a lot of people who work there, and I accept that today there is a huge stress on the system in the hospital, and the management are responding to that as best they can. There are 2 issues here. There is today's pressure to deal with, which is difficult for staff on site. And they are working together to deal with that. And there's the medium-term issue here, which is about capacity. And that is why the government is increasing capacity and has been doing so now month on month, and will continue to do that. And if you look at the increasing trend in terms of the increasing numbers of beds that are being both funded and provided, you will see it moving in only one direction. The truth is we need more beds in our system. And we have the budgets and the plan to actually increase beds, not just in Cork, but in other parts of the country as well. You mentioned Limerick earlier, and there is a commitment to increase bed capacity in Limerick through I think it's a 60-bed modular unit, which is funded and committed to this year.
Thank you, Tánaiste.
So, Deputy, there is a recognition that more investment is needed, more capacity is needed, and it's being provided. And in the short term, particularly through winter months, we need to ensure that management systems are in place that are actually, in general terms, delivering reductions in the number of people who are on trolleys. But there is an acute problem in Cork, both last night and again today, which is getting the emergency response that's needed.